Much for joining us today. I'm Samantha Mokas, and I work with FLAACOs as the Director of Member and Partner Services. We are excited for the opportunity to present to you our next installment of our free webinar Wednesday series. Today, it's going to be the ENS or the ACOs brought to you by the Florida HIE Services and Audacity Inquiry. Before we get started, I'd like to go over a few items so you know how to participate in today's webinar. You should see an attendee interface on your computer desktop in the upper right-hand corner. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select the telephone in the audio pane, and then the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenter by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the question and answer session at the end of today's presentation. With that, I would like to introduce to you Aaron Parsons with AI. Aaron?
Great, thanks for the intro, Sam, and thank you everyone for taking some time out of your busy day to join us this afternoon to learn a little bit about the Florida Health Information Exchange and the Encounter Notification Service. As Sam mentioned, my name is Aaron Parsons. I'm with Audacious Inquiry, and we are the vendor for the service. And I've been involved with a variety of health information exchange projects here in the state of Florida since 2011. So started with meaningful use with the Medicaid EHR incentive program, did a little bit of work on e-prescribing and direct, and now am the outreach lead for Audacious Inquiry for ENS in Florida, which is what brings me here this afternoon to talk with you about ENS for accountable care organizations. So just go ahead and jump right in. A quick overview of what we're going to be talking about. I'll give a quick tour of the service and what it is that we're talking about. I'd like to spend a few minutes kind of talking about the impact of ENS and the value that some of our participants have been able to document and demonstrate and have provided to us to share with interested folks. Then we'll take a little more detailed ride, a little more detailed look at how ENS works and how your participation in the service would look. We'll talk about sample notifications and endpoints, pricing, and then next steps for connecting if you're interested. And then I think as Sam mentioned, we'll have time at the end of the hour for any questions that anyone on the line has. So a quick overview of ENS, of the Encounter Notification Service. What ENS is a service that routes hospital encounter data from participating hospitals to subscribing organizations like ambulatory practices, hospitals and health systems, accountable care organizations, and health plans. You can see from the map on your right there that we have really great hospital coverage in the state. We have 220 hospitals that are connected and sending real-time encounter data to ENS. These 220 connected hospitals constitute about 95% of acute care hospital beds statewide. So we really have great coverage in this space. The feeds that we receive from the hospitals are real-time data feeds, and they include inpatient and emergency department encounters and provide notice of admissions, discharges, and then transfers between departments within the facility. So we're also looking right now, we're currently limited, just a side note, right now we work with acute care hospitals, but we're also looking at branching out and including other sources of data in the future. We know that there's a lot of interest in long-term and post-acute care, skilled nursing facilities, and so that's something that we're working with a number of partners on establishing some connections so that data will be available. But for now and over the short term, we're just talking about acute care hospital encounter notifications. Just for your reference, the complete list of participating hospitals is available and posted online at our website. I have the URL at the end of the presentation, and that way if you want to see whether or not the hospitals that you work with most frequently are participating in ENS, you can just go online and check out that list. And again, I'll have that for you at the end of the presentation. So that's a very quick look at what the service is. It's providing notice of acute care encounters, inpatient and emergency department at hospitals all around the state. So I want to take a few minutes and just talk about the value that our participants have indicated they found from participating in the service, and then we'll dive into the details of how it works. So one of the key things that's been highlighted by recipients of this data is that they're getting better data than they had available to them previously. One of our participating ACOs had a direct ADT feed, admit discharge transfer feed, from the only hospital system in their service area. And this was a non-ENS feed, so they had a direct feed from the hospital. And they realized via claims that they were missing significant ER utilization from this direct feed. So they subscribed their patient population via ENS and realized after they started getting data via this platform that they were missing about 35% of their total patient utilization without an ENS subscription. The reason being is that this ACO is located in a large metropolitan area. Folks tend to travel a bit further for work. They drive across town, 45 minutes, an hour to go to work. And they were oftentimes visiting hospitals outside of the ACO service area. So while the ACO had a direct feed from the hospital in their service area, they didn't have a window into utilization at other health systems. And so connecting to ENS by subscribing to their patient population gave them a better window, and they had better real-time information about their patients' hospital utilization. That's really valuable for a number of purposes, not least of which is being able to follow up with those patients after they're discharged from the hospital. So another ACO that we worked with to document the ROI, the value that they found from participating, indicated that they had over 73,000 transitional care management eligible discharges during a particular study period. So transitional care management requires that the physician be in touch with the patient within 48 hours of discharge and then have the patient in for a visit in the primary care setting within 2 weeks of discharge in order to provide transitional care management services and then bill CMS for those services. So TCM is a really terrific revenue opportunity for an ACO, for physicians, and it's also a great opportunity after the patient has been discharged to provide them with follow-up care, to explain their discharge instructions to them, to do medication reconciliation, to do a lot of those activities that are really very critical after one of your patients has been seen at the hospital. So great opportunities all around here for the ACO, for the patient, if only the ACO or the physician is aware of the encounter, which ENS permits. So the same ACO that found that they had 73,000 TCM eligible discharges during a study period was able to leverage ENS to get almost 70% of those same 73,000 patients. So they got over 50,000 of those patients in for a follow-up visit within the required 2-week time frame. So leveraging the data really opened up, like I said, a great revenue opportunity for them, and even more importantly, a great opportunity to follow up with their patients, to be aware of the discharge and provide transitional care management services to them after their hospital encounter. Another ACO that we worked with reported that having access to this data allowed them to realize a 40% reduction in hospital readmissions per quarter during their first year of subscribing to ENS. So in working with some of our ACO partners, we've been able to get some really great numbers about what they've been able to do with the data. A few more numbers just to throw your way and kind of demonstrate the return on investment that's possible. Another ACO, and this is one of the same ACOs that I mentioned previously, that has a fairly small panel with us, about 10,000 patients, attributed a total annual savings of $284,000 to their ENS subscription via avoided readmissions. So just knowing about their patients' admissions in real time, being able to provide those TCM services to follow up with the patients, they calculated a significant reduction in readmissions that they calculated came out to a total annual savings of over $250,000. And we'll get the price a little bit later, but that's far, far more than what they paid for the subscription. And another participating ACO in documenting their ROI saw their average 90-day total spend post-discharge decreased by almost $1,900 per instance when using ENS to provide transitional care management services to their patients. So their 90-day total spend post-discharge went down by almost $1,900. So that's really great opportunity to get better data, improve care, reduce admissions and readmissions, and then to save money. And for ACOs, that's obviously critical to your success. So we're excited to be able to offer this service. We've had really great participation among ACOs, and we're excited to bring this to the other ACOs in the state that we're not yet working with. So that's what we see as the value of participating. I want to kind of pivot here and talk a little bit about how the service works and how you would participate if you were interested in receiving this encounter data and using it to improve care. So in order to participate, a subscriber, in this case an ACO, would submit a list of patients to ENS. And that list of patients would include the patient's first, ideally middle, and also last name, date of birth, gender, address, so the street address, city, state, and zip, telephone number, and other demographic information. And at the same time, we receive this panel from the ACO, and we have the hospitals that are connected sending us inpatient and emergency department ADTs in real time. And within these ADTs that we get from the hospital, it contains all that same information: first and last name, date of birth, gender, address, telephone number, and other demographic information. And how ENS works is, rather than relying on the patient to successfully attribute themselves to their ACO when they're being seen in the emergency department or as an inpatient, or to indicate who their physician is, instead, ENS matches the incoming hospital data to your patient list based on the patient demographics that have been provided. So it's looking at, again, the first, last name, date of birth, gender, address, and other demographic information, and using a very conservative, highly sophisticated matching algorithm, it is identifying positive matches. It's really a really great and fascinating process by which this happens. There's a number of different facets of it, so I don't want to go too far into the details on it. That's not our main topic today. But there's some amazing tools. There's nickname tables. There are Soundex tables for names that phonetically are similar but are spelled differently. It can account for typos and other mistakes that are commonly made, common name misspellings. It really does a lot to go ahead and look through and indicate when a hospital patient is in fact the same patient who is on your panel. And when it indicates a match with a very high degree of probability, that's the information that we then route out to the organization that has subscribed to receive that data. So those matched ADTs we route out to you, and the unmatched ADTs we discard from the service. So, and then your preferences as a subscriber would dictate the how, when, and where of alert delivery. And I want to go ahead and dive into that a little bit more so you can understand the options for how you receive this kind of data. So the basic data elements that are included in the alert are based on the data that we receive from the hospitals. And I have a sample alert here that I'm going to go ahead and open up, and we'll take a minute to explore. But it's going to include basic information about the encounter. So the patient's first and last name, date of birth, gender, address, phone number, the information that they provided at hospital intake. And we know that that's helpful. Working with a number of our subscribers, they found that up-to-date telephone number to be indispensable for working with their patients post-discharge. But it also includes information about the hospital encounter. So the facility where it occurred, the date and time, whether you're being notified of an admit or a discharge, whether it's inpatient or emergency. And then there is information about the encounter itself. So the attending physician, the patient's primary complaint, the discharge diagnosis, the discharge disposition, so Were they sent home? Were they sent to a skilled nursing facility? It doesn't name the specific facilities, but it lets you know where they were discharged to, and other relevant information. We'll take a quick tour of that, of a sample alert, in a few minutes so you have an idea of what the data looks like. Also included in the alerts are any data that you provide to us up front as part of your subscriber panel. So we ask, and we have a standard template that you would use to provide us with your patient information. But within that template, there are optional fields where you can include additional information. So if you wanted to include a list of chronic conditions, or the patient's next of kin, or the primary care physician within your ACO who is responsible for that patient, or a direct address for that physician, whatever you want to be routed back to you as part of the alert, if you give it to us up front as part of your panel, when the patient has a hospital encounter, we'll not only send you information from the hospital, but we'll include the information you already gave us as part of that alert. That way you can enrich the alerts a little bit and contextualize them with some additional information that you've provided as part of your panel. So let's take a quick break here and do a tour of what a notification would look like. So I'll go ahead and open this up, and we'll take a quick look around here. Just to be clear, this is mock data. You know, the date of births are all the same. The name is listed as test. There is no PHI in here. This is all very much mock test data. So no concerns about sharing anything inappropriately here. There's another platform that I'm going to demo that also has mock data in it. It looks a little more real than this, but just to be clear up front, we're not sharing any PHI during the webinar here. So anyway, a quick tour of what we have here. So there is the MRN that you would receive. It's shown here in column C. That allows you to follow back up with the hospital to request a more comprehensive record of the patient's hospital encounter, whether that's a discharge summary or the full CCD. You have the MRN so that you can follow up with them. Patient's name, demographic information that they provided at intake, so address, phone number, any additional phone numbers. You also receive the insured's ID number, as well as the insurance company, and the insurance company ID, which may be useful to your system. The event, whether it was an admit or a discharge. You'll notice a few other event types in here. We have transfers, pre-admission, change outpatient to inpatient. Most of these are going to be admits and discharge, but there's some other data, useful data that's in there as well. There's also a column indicating whether this is inpatient or emergency, your event date and time, the name of the hospital where the event occurred. There's an indicator for whether this is a readmission. And I mentioned the MRN before. This is actually the column that has the source MRN, the hospital's MRN in it. There's an episode ID, which is really very useful. That helps you know that this particular admit is tied to this discharge. So if you have someone who is admitted and discharged and then returns the next day, having the episode ID lets you link the admit with its corresponding discharge appropriately. So you have a unique ID that links those together. And then there is information about the patient's hospital encounter. So patient complaint, as well as the department where they're being seen, the attending physician's name, and then the diagnosis description and diagnosis code. You'll notice there is some gaps in the data. A big part of that is because in this example that I'm sharing with you, this includes both admits and discharges. So your admits aren't going to include a discharge diagnosis. So if we kind of narrow this down a little bit just to look at the discharges, you'll see that information is going to be populated a bit more frequently. But it's not there entirely, right? So you notice a couple of these for diagnosis description. There's 2 out of the 7 or 8 here that aren't there. And part of that is just the timeliness with which we're getting this data to you. So we're sending this to you as it's generated within the hospital system. So the hospital generates it, they send it to us, we're immediately getting it out to you. So you're receiving this within 15 minutes. And that's giving us a good bit of leeway there. You'll actually receive it a bit quicker than that. So you're getting it in a very timely fashion, which means that the hospital hasn't always had a chance to code the diagnosis description, diagnosis code, and the data that's outbound. So you should expect it to be populated pretty frequently, the majority of the time. But the timeliness with which we get this out to you means that there will sometimes be gaps because the hospital has not yet populated that data in their system. Throwing that out there, trying to set proper expectations. So you do have the option of receiving it as a CSV file format, or you can receive the data as raw HL7 data. So if you want to ingest this into your analytics platform or into your EHR system, instead of providing it to you as a CSV, we can send it to you as raw structured HL7 data. Again, like I mentioned before, this is all test data, but you can just go ahead and ingest that straight into your EHR if that is the preferred path. So some enhancements that, potential enhancements that we're looking at over the medium term for the service, we have a number of different opportunities to grow the value that's being provided by the service. And while what we're delivering now, acute care hospital encounter notifications in real time, really does drive a lot of value and delivers a lot of value to our participants, we're certainly looking for ways to deliver more value. One of them I already mentioned, which is adding new types of data. That post-acute space is of particular interest among our stakeholders, so we're already aware of that and working on it. But there's other opportunities for additional enhancements to the service. I'm just going to discuss these really briefly. There are a lot of dependencies here, and some of them are going to be more likely than others. But what we can do via either aggregation of the data that we're receiving or integration with outside data sources is present you with a utilization history. So you would have an acute care encounter history that would require us to hold on to the inbound data that we receive from the hospitals, which, as I mentioned before, we don't currently do. If we were holding on to that inbound data, we would also be able to calculate risk scores and provide those to you as the patient is admitted to the facility. We'd also be able to provide you with a list of chronic conditions that have been documented during prior encounters. And again, these are dependent on aggregation, which is currently not something that we're doing, but something over the medium or long term that may be a possibility for the service. Another possibility in the future is integration with the state's PDMP database. That would allow us to query the database and return a prescription history along with the notification. That is a conversation that's underway. There was legislation in the past legislative session earlier this year that allowed the state's PDMP to integrate with EHRs. So we're exploring our options with them about connecting to this service and routing the data as part of notifications that you receive on patient hospital encounters. So again, there's a lot of dependencies, a lot of things that have to be done before this is possible. Don't want to promise anything that is not yet in place, but these are options that we're exploring, again, to enhance value that you're receiving. And for PDMP, there is the option for integrating directly using your EHR. So I don't want to foreclose that as an opportunity or as an option for folks. That's definitely something that's on the table with your EHR vendor. So, and then another opportunity, I think this one is something that can be done on a shorter time frame than the others, is providing you with care team information. We're still exploring the context of the service and who we need to get buy-in from to do this. But what we could do is when we send you an alert, we can let you know who else is subscribed to that patient. So if there is a payer, and we have great payer participation, or health system or another provider, someone outside of your ACO that is subscribed to this patient, we can let you know who those folks are. And that way you have a better idea of who else is involved with this patient's care, and you have an opportunity to coordinate with them around your efforts. So those are all potential enhancements that we're looking at over the short, or for most of these, medium or long term. But again, we're building out the service and building out the value that we're delivering. I want to kind of pivot a little bit and talk about your options for receiving the data, your endpoint options. There's a couple of them that I want to explore in a little bit of detail. One is you can receive this data via direct messaging. And that can be through any certified HISP. If you have a certified EHR system, which I imagine most everyone on the phone does, and your system has a Direct Trust accredited direct mailbox that's included in it, you could use that to receive these notifications. Or if that's not an option, we have a direct service, a direct services provider that we're partnered with, and you can set up some mailboxes through them. So direct is a great option, particularly if you're having the alerts batch delivered to you. And by sending them by batch, you would get just 1 or 2 batch notifications a day that you could then use to go ahead and reach out to the patients and reach out to the health systems for scheduling those follow-up appointments, for getting that clinical documentation from the health system. You also have the option of having the data delivered in real time, but those would come in separate notifications. Your inbox would get pretty full, so that's maybe not the best approach to this. But anyway, direct is one of the available options for receiving the data. Another option, I think our more popular option, is to set up a secure FTP site. And that can be one that is hosted by Audacious Inquiry, by the vendor for the HIE, or if you have an SFTP site already, or you have a vendor that can provide that, we can certainly use yours as well. So a couple different options there, but we would just drop the files in batch or in real time to the SFTP site, and your system could be set up to just run an automated job to go pick those up on a routine basis. So another option that we have for accessing the data is our prompt user interface. Prompt stands for Proactive Management of Patient Transitions. And what this is a lightweight care coordination tool that you can use to interact with the data that is available via ENS. So we have a screenshot here. Again, this is all test data, so none of this is real. What I'm going to do is I'm going to exit out of the slide deck and very briefly just do a quick demo of our prompt service. And it's not our focus today. Our focus is just on the encounter data, but I'm just going to do a quick demo of what the data would look like if you were interacting with it through this platform. And again, as I mentioned with the screenshots and the CSV file that we looked at before, this is all test data. So I'm logged in here, and I just want to do a quick overview for you so you can see what it looks like. So on the left-hand side, you see that there is a queue of notifications, and this is all of the notifications that have been received by this subscriber since they went live with the service, since they went live with Prompt, since they set up this option for accessing the data. And you can click on any one of these notifications and see the detailed content that is included about their encounter. And again, test data, just want to make sure we keep that at front of mind here. And then you also can look at the event history for that patient, again, date forward from the time that you set up a Prompt account. So you can look at prior events that they had since you've been subscribed to them and since you had a Prompt account, and that gives you some context for their current encounter. We're also working on releasing an updated version of this tool that includes a notes entry functionality so that you or other members of the team at your ACO can include notes about having contacted the patient, scheduled a follow-up, or care that's been provided, or resources or materials that have been provided to the patient. There'll be a free text notes option on the latest version of this that we release. I believe that comes out next month. So you can go ahead and add notes to it. You also have the opportunity to treat this like a work queue. So you can indicate for Terry Burke here, again, not a real person, where you are at in terms of your interaction with this patient. So you can say that you're not started, or perhaps you've already called this patient and interacted with them and scheduled an appointment for them, which has not yet occurred. You could put that in the notes for them and then mark this notification as in progress. And that moves it from the not started queue over to the in progress queue. And it does that in real time. Your notifications populate into this platform in real time. And then once you're have completed your work with this patient, they've come in for their post-discharge visit, you've provided the TCM services, and your interaction with the data for the purposes of that encounter is completed, you just mark them as completed and it moves them over to that last tab. So this gives you a really great work queue where you can interact with the data and interact with other members of your ACO team using the notes function and using the queuing function where you can indicate the status of the patients. A couple other really great features of this interface. You can search by name or MRN. So if we wanted to look for someone who shared my first name, we can go ahead and find him there and go ahead and look at the notification. So if you had a particular patient you were looking for, or you had their MRN, you can search for them and pull up their data that way. And again, this is data that is all date forward from the time that you started your subscription and set up a prompt account. So this doesn't backdate to an earlier time. I think that's important to note. You also have the opportunity to add filters. So we have all of your notifications over here on the left-hand side. In this test account, there's a little over 1,000. If you wanted to add filters to that so that you only wanted to see data that came from, let's say, Mount Sinai, then you can filter that down to just the notifications that came from Mount Sinai. There are a bunch of filters in here. You can filter by the admit date or time. So if you wanted to put a time range on there from from the beginning of 2015 to the end of 2017, just as an example, that will pull everyone whose notifications fall within that time frame. And then another great feature of this is that let's say you've done some filtering and it's really great for particular work that you're doing with some of your care coordinators within the ACO, you can save that filter. So this is for care team 1, 2, 3, and that corresponds with a particular clinic in your ACO, and you can save that filter so that next time you come in, you can just pop up that filter at any time and cone back down to that particular data almost instantly. So Prompt provides a little more some additional tools for interacting with the data. And you may already have these tools available through systems that you already have access to, in which case it's great. You can just import the data that we send you into the tool set you already have. But if you need access to another set of tools for interacting with this, we do have this available. The great thing about all these options, so the format that we send you the data in, the frequency, whether it's batch or real time, the endpoint, whether it's direct or SFTP or prompt, or some combination of all of these, right? We have some subscribers that have both prompt and an SFTP site because they're using them for different purposes. So whatever configuration of this you choose to set up, it doesn't impact the price. The price is going to be the same no matter how you configure your subscription. Prompt doesn't cost anything extra. It's just a tool set that we have available that you get as part of a standard subscription. And subscription configurations, I think it's good to note, are also not only configurable, but you can change them over time. So if you start and you're interacting with the data via SFTP and you decide, yeah, that prompt tool looks like it would really be great, or perhaps some of you on the phone are already current subscribers and you're learning about prompt for the first time and you want us to go ahead and set up an account for you, all you have to do is send us an email and we'll go ahead and go through the process of doing that so that you can have access to that tool. So all configurable and all subject to change based on your preferences and your needs as an ACO. So it's kind of a summary table of the data formats and the methods by which you can receive them. So I talked about direct and SFTP and prompt. There are some other, technically some more sophisticated options for receiving the data. Usually most of our subscribers are using direct or SFTP or prompt, but there are a couple of options here to explore. And obviously you can see direct has a lot of flexibility in the format. Our SFTP option, we're just delivering that only as a CSV file. But anyway, lots of optionality, lots of choices in terms of how you receive the data. That's kind of the point I wanted to emphasize there. So the pricing. Let's go ahead and take a few minutes and talk about this. The standard pricing for an ENS subscription for accountable care organizations is $1.50 per patient per year for each of the initial 50,000 patients. Above 50,000, we know there are a number of ACOs that have more lives than that. The cost is 25 cents per patient per year for each additional patient above that initial 50,000. So each of the first 50,000 are at $1.50. Everyone above that is 25 cents. And our standard practice is for invoices to be sent out quarterly, but we're flexible in that. If you prefer something annual or otherwise, we can work with you on that. So a couple of quick examples of what this would look like for a panel of 8,000 patients. Those 8,000 patients would be at $1.50 per patient per year. So that would be 12 grand for the year. And since we bill quarterly, divide that by 4, that comes out to 3 grand per quarter. For a panel of 20,000 patients, that would come out to 30 grand a year. Again, divide that by 4 because we bill quarterly, and that comes out to $7,500. And at first glance, looking at the prices, it's, well, this is, $1.50 per patient per year. It's not exactly peanuts, but I do want to point back to the earlier slide. I think it's really important that this be looked at as an investment that has a really great opportunity to deliver significant returns. So I mentioned the ACO earlier that had a small panel of 10,000 patients. So in 10,000 patients at $1.50 per patient per year, their annual cost for this was $15,000 to cover those 10,000 patients. And they attributed a total annual savings of over $250,000 to it. So from the perspective of this ACO and the approximately 25 other ACOs in Florida that we're working with, they're seeing a good return on investment, and it's worth the cost to get set up. So I don't want to, give the impression that there is no cost. We got to talk about the costs in clear detail so everyone understands. But I think we got to consider it in context of the larger opportunity to be able to receive that data. So that's a quick overview of the service, of the value that we see. A number of our participants pointing to. We're really excited to be partnered with the majority of the ACOs in the state already. I believe we have currently about 25 subscribed, which is over half of the Medicare Shared Savings ACOs in the state. And we're really excited about our partnership with FLAACOs and for the opportunity that we have to present this information to FLAACOs and to FLAACOs members this afternoon. So Sam, that is my spiel, and we have the balance of our time for questions. I think you have the lines muted and folks need to raise their hand. Is that right?
No, actually, they've typed them in. So I do have two questions. Both are from Gil. So Gil asks, will you include CCD XML file data with discharge?
So that's a great question. We do not currently route anything other than ADTs. So this is just ADT data, the content of which we showed in the demo on the screen there. It's a fairly thin slice of clinical data, right? You get the discharge diagnosis most of the time. You get the discharge disposition, whether they went home or to a skilled nursing facility or elsewhere. And the real value is in the actionable nature of the data. So the platform is capable of routing CCDs, but we're not at a place where that is content that we're pushing out over the network. Capabilities there, we're just not there in terms of having that available to us. But again, the real value is in the actionable nature of this, that you're getting it in real time, that you're finding out now at 1:40 p.m. on May 16th that your patient was admitted to the hospital down the road 5 minutes ago. That's the real value. And it does give you an opportunity, because we include the MRN, to follow up with the facility and retrieve those records. But no, we're not currently transporting CCDs over the network. But great question.
Okay, awesome. And there's one more. Gil also asked, is the ENS service available to providers outside of an ACO or HMO?
Another great question. Yes. So, and that gives us a chance to talk about consent a little bit. Yeah, the service is available to pretty much any provider organization acting as a covered entity that has authorization to receive the data. So for ACOs, they are covered entities. They're also business associates of CMS, which gives them access to the claims data. And there's not anything that you're going to receive via ENS that you don't get 2 and 3 months later via claims that come through CMS. So it points back to the real value of the data, which is the timeliness of it. You're getting it in real time. You're finding out today about admissions that happened today, and you have an opportunity to be part of the care that's being delivered while the patient's in the hospital, and also to help coordinate their care and to kind of play that key role in managing their transition home or into skilled nursing or into another post-acute setting. So yeah, great question. It is available to providers outside of ACOs. It is available to health systems, to payers, to, and then obviously the most relevant thing this afternoon is its availability to ACOs. Just a quick little kind of historical note. We started just with payers. And what really kind of opened this up for other folks to be able to participate were the ACOs here in Florida that came to us and said, we really want this data. We see very immediate and valuable purposes to which we can put this data. And it was the ACOs who came and knocked on the door and were really excited about the opportunity that led the state, because this is a state-led initiative, to go ahead and open the doors to a broader array of providers. So we started with payers, and then it was payers and ACOs, and then more recently it's become available to providers outside of an ACO setting or to health systems directly. So yeah, another good question. Thanks, Gil.
Well, and Gil actually has 2 more questions on his one about the service for the service availability. If so, what is the price per patient per year or for smaller panels?
So the price per patient per year is the standard pricing that's listed right there.
So it would be the same for the ENS service as well?
For providers?
Correct.
Okay, right. So there is a different rate for some providers. That information is posted out on the website. And Gil, if you want to follow up with me separately, I can point you to that. And part of the idea, since the state has the governance over the project and is also one of the larger payers in the state as the Medicaid agency, as a state Medicaid agency, they had an interest in making sure that this was widely available to Medicaid providers. So they were part of the conversation about lowering the price for some categories of providers out there. So yeah, there's a slightly different pricing model for providers. It's still a tiered one like this. But to the other part of the question about a minimum, that's a good question. There is I believe a $2,000 minimum, whether you are a ACO or provider. That's also posted online and is available out there for folks to take a look at and peruse. Yeah, but it's a good point about the minimum. There is a pricing minimum. We just gotta kind of have a floor on it so we're not getting a panel of like 10 patients. So also a good question. You said Gil had another question?
It was just asking to it. You answered both of them. So, but I will make sure Gil has your contact information after this webinar. So if he has any more questions, he can reach out to you directly. Along with everybody else on the call, you'll have Aaron's contact information. Okay,
that's great. And we have a shared mailbox that is currently on the screen right now, the FLAACos_service desk, that middle entry right there. That address comes to me and to a few other folks on the HIE team. So that's a good way to get quick responses as well. Or folks are welcome to call me directly. That's my direct phone number on the line. So if you're not tired of hearing my voice yet, after the webinar ends, you can call me directly, and I'd I promise I'll answer. So that's a direct line there if folks have questions after the webinar wraps.
Awesome. Does anybody else have any more questions? Or Erin, is there any frequently asked questions that maybe that no one has asked that people maybe would like to know?
One of the questions that we often get, particularly from the IT teams at the organizations that we engage with, no one's really eager to take on a big IT project, right? There's competing priorities, there's limited budgets, there's a lot of other stuff going on. No one wants a big IT project. So I think it's good to point out that this is not that at all. The process that was outlined in the slides, where I talked about, as a subscriber, you send us a patient panel, and then we go ahead and set up your endpoint, and we kind of set up the subscription the way that you want it. We're sending, whatever frequency you want, and what format, and what kind of endpoint, whether you want a direct mailbox or prompt. We go through those steps, but from a technical standpoint, that's all really fairly simple. The hardest thing might be generating the patient panel, and that's not a big lift. So I would just stress the simplicity of this and the speed with which we can move. Someone who was ready today and had a patient panel ready, you could start receiving alerts before the end of the month, well before the end of the month. So it moves fairly quick. And since we have a minute here, other common questions that we receive, one is about the process of what steps do you take. And I know I just mentioned the panel and the subscription preferences. The process involves a couple of steps. One is to sign the standard agreement. That's posted on our website, and the URL is right there. I promised earlier the URL where you can find the list of our hospitals. That's that same website. Really, everything you need is going to be on that website. But the standard agreement is there, so you would have your legal folks review that and then have an executive sign it. We have an onboarding checklist where you tell us whether you want direct or prompt or batch or real time, and you kind of fill in the details of how you want to participate. And that's it. So the agreement, the checklist, and then you send us a panel, and we start sending you alerts. And we have to set up your preferred delivery option, but then we can start sending you alerts. So it's really one thing to stress, and a common question is about the amount of effort, and I'd really want to just stress the simplicity of the whole thing. Again, my phone number is right there, so if there's any point in this process that ends up not being as simple as was anticipated, it's easy enough to get one of us on the phone and we can walk you through it.
Awesome, Erin. I know I really appreciate it. And on behalf of all the FLAACOs members, we appreciate you taking time out of your busy schedule to have a presentation with us today. So I just want to thank you again for all that, and thank you for everyone for participating. Once you all exit, you'll receive a survey on the presentation. We would definitely appreciate if you would complete that and provide your feedback. We will also be sending an email with contact information. If you have any follow-up questions and a link to the webinar recording, please feel free to share that. Also, just a quick reminder, registration is open for our October conference. It's our 5th annual FLAACOs conference. It'll take place in sunny Orlando, and it's October 18th and 19th, and we hope to see you all there. I hope everyone has a great rest of their day, and thank you all again. Have a great day.
Yeah, thank you. Thanks, Sam.
Thanks. Take care.
You too.